Bob's sister Donna is in her late 50s and her feet were a real mess. She has blisters, hammer toes, a whole array of other foot and ankle problems. Her doctor even suggested surgery was needed in the future.
This was not a minor problem for Donna. It was affecting her walking program, which she really needed for health as well as mental calmness.
So Bob had Donna follow the advice of Dr. Ray McClanahan, who we consider to be one of the world's best podiatrists.
So we're going to show you the 3 critical treatment options that she did.
So the first thing Donna did was stretch her calves. In order for her to do this, she went on the stairs like this. Her forefoot remained on the step, and her heels just let gravity pull them down like this. You can hold this from 10 seconds all the way to 30 seconds.
Now, it's really important to understand, and you may be questioning, well, why are we stretching the calf when the pain is down in the forefoot or anywhere in the foot? Well, the calf muscles are directly connected to the calcaneus to pull the ankle in a certain direction. It makes a big difference. If this is tight, it definitely affects the forefoot as well as the bottom of the foot, plantar fasciitis included. If that's a problem, this is a critical stretch. We start from the beginning and don't miss any problems from there.
In addition to the stretching of the calves, Donna also had to massage her calves and just really dig into that calf muscle belly. You can even work your way down to the back of the ankle. Now, if you're massaging for 5-10 minutes and your hands are getting tired, you can certainly use something like a massage gun or other massaging tools to help as well.
That's right. And Bob, being the good brother that he is, he actually bought Donna a massage gun, and so she got one. And actually, you want one with the round head. It seems to work the best, and I'll show you why. We're going to go in and massage the muscle here. Now, you may find some tight spots, and they're usually a little more tender, and those are the areas you spend more time on. If going straight in on that tender spot hurts and is too aggressive, this is the advantage of the round head. You certainly rotate and come in at a side angle, much less aggressive, but it gets that cross friction benefits, which is really helpful on the muscles. So the cross friction is this direction. You can go this way, but this is the way we found to be the best. And then obviously, if things aren't work out well, you can go down into the tendon, the Achilles tendon, or here into the soleus muscle, the gastroc, all those things that therapists think about. You don't need to know that. It's a wonderful way to massage that muscle.
The second thing that Donna did is switch her shoes, and she wasn't happy about this because she called them clown shoes. But what we're talking about is the toe box here. If you look at these shoes, we want to look for a wide toe box like this compared to these New Balance ones. They have a narrow toe box. Many issues in the feet, including hammer toe, bunions, even plantar fasciitis, can be caused by having a narrow toe box, which most brands are. Now, you can start by perhaps buying a wide shoe to initially start. Many brands make wide shoes, but eventually you want to get to a brand that has a wide toe box like this and also a zero drop. Eventually, you may have to gradually work into that. What I mean by zero drop is the heel to the forefoot is all the same height off the ground.
Right. Now, this is absolutely critical. Now, Dr. McClanahan, when he treats his patients, which he has great success, this is an absolute must. They must get a wider toe box or he will not treat them. Okay, so looking at the big picture here, we're looking at eliminating the shoes with the tight toe box, which most shoes have. Now, that's going to allow your feet, your forefoot, and your toes to get wider in the natural position where they had when you were born, actually. So now we're going to go to the next step. Mike's going to talk about inserts to put between the toes to actually allow that natural position to be acquired.
So the third thing Donna did was get some correct toes. These are a form of toe spacer. The difference between these and other ones is you can functionally wear these. You can wear them while you're walking or running. Simply put them on your foot, and then you can put your sock over top to keep them in place. A nice thing about these ones is you can adjust them to fit your foot, your individual foot. You can trim the sides if needed, or you could put stuff into the spacers if you needed to extend out more. Each foot is going to be individualized, and you want to make sure to order the correct size as well. So as you can see, once you put them on, it's going to align my big toe, which is going to help with Donna's bunions, and also it's going to help keep this hammer toe down and flat, helping correct that issue over time. Now, your feet may not look like mine because I've been wearing these for over a year now with with the wide base shoes. I do not wear the spacers anymore. But as you can see, they help keep things spread out how your natural foot position should be.
That's right. I like to think of it as braces in your teeth. You know, you put braces on, and over time, your teeth straighten out the way they should be so they look good. This actually straightens out your toes and allows them to be in the natural position over time. And Donna did exactly that. All right, so the results that Donna had within a month after starting this program, she noticed notable decrease in foot pain and her walking improved. Now, after 6 months, she's just about completely resolved. She's walking 3 to 5 miles as she did before. She's a very happy person, and she's grateful to her brother, Bob.
And if you want to watch more videos on foot pain, you can click on this one right here. Put it over Brad's face.
Why, Mike? Why?
Bob and Brad, the two most famous physical therapists.